All right. Good afternoon, participants, both here and online. Welcome back to our session. I hope you learned a lot from our fruitful discussions and our panel discussions, as well as with our very able speakers in our forum. This afternoon, we will do session 7 on AI regulation and oversight pathways for different realities. I now hand you over to our moderators, Menki Chen from WHO and Jae Kyung Kim from ADB.
Yes, thank you very much, Alia, and good afternoon, everyone. Hope everyone had an enjoyable lunch. So the session now on session 7 will be on AI and regulations. It might not be the most exciting topic, but I think it's one of the most important topics as well. As we know, it could be twofold because without a robust regulatory system, when we deploy the AI technologies, it could take forever, which we are seeing in the innovative technologies as well. And in the other hand, if we don't have a robust regulatory system, as we are learning in the sessions, it couldn't be used in the most appropriate way, which is good for the health of the people. So regulation is really important. So we have a very good extreme list of panelists and speakers for the session. First, I would like to introduce Ms. Pei-Ling Yap. She's a chief scientist from Health AI. She'll be sharing about the global perspectives. We were actually trying to have her in person, but due to the recent global situation, she will be joining virtually. So over to you, Pei-Ling. Hope you're there. Is Pei-Ling connected? IT team? Pei-Ling, can you hear us? Oh, yes, I see you now. Can you try speaking?
Yes, great.
Okay,
yes,
great.
I can hear you. Can you hear me?
Yes, we can hear you well.
Thank you so much, Jay. Yes, great. Thank you very much again to Jay and Mengji, so ADB and WHO for having Health AI on this panel, and myself. If we can have my screens, if we can have my slides on the screen, that would be great. Can you hear me now?
Yes, we can hear you. Please proceed.
Yes, I cannot see my slides. Okay, no, that's good. They are on now. So let's hope this goes well. So yeah, again, hi everyone. I'm Dr. Pei-Ling Yap.
Yes, we have you now, Pei-Ling. You can start your presentation. Yes, Pei-Ling, maybe if you can switch off your camera, it will be saving your bandwidth. You're on mute. So Actually, it's a bit difficult to skip her presentation because she's the scene setting, but okay, Pei Ling, let's try it the last time. And if it doesn't work, we will just proceed with the next speakers. Pei Ling, could you try your presentation now? Yeah, Pei Ling, please go ahead. Pei Ling, you're on mute in case you're speaking. Okay, so we'll try Pei Ling later. And next speaker will be Professor John Lim. We also tried to get him in person, but he's in an event in Singapore. So he sent his, shared this video. So yes, the IT team, please play the video from Professor John Lim.
Hi, Jay. Can you hear me now, just in case you can hear me?
Thank you for inviting me to share on healthcare AI regulation in Singapore. I'm sorry I cannot be present with you due to a conflicting meeting arrangement, but I'm happy to give you a perspective on the approach and scene in Singapore. This is the scope of my presentation, which I will not go through, but we will try and cover these in the course of this presentation. Essentially, we view regulation as an enabler so that we find a good balance between protecting the public as well as enabling and facilitating innovation and new technologies. When regulation is done well, we believe it helps to sustain development, and also there are socio-economic benefits and outcomes, but importantly, it does promote equity by ensuring improved access to essential medicines, devices, and vaccines, as well as high-quality health services. The Duke and US Center of Regulatory Excellence, or CORE, was established 12 years ago with support from the Singapore Ministry of Health, the Health Sciences Authority, and Economic Development Board to address the areas highlighted in the orange boxes. Coming specifically to Singapore's health regulation framework, this slide describes how we have been traditionally organized, with the Ministry of Health regulating health services, the Health Sciences Authority regulating health products, and Ministry of Health statutory boards regulating health professionals, with, of course, the focus on patient safety at the center. But a major regulatory transformation review is underway now, and the health services that has previously been regulated by the Ministry of Health is now moving under the HSA, so that the regulation of health products and health services will be under a single organization going forward. And in fact, we're taking this a step further so that by the end of 2027, the Secretariat that supports the regulation of health professionals will also come under HSA. And this consolidation of health regulation, which we think is quite unique, we've not seen it elsewhere, will in fact help to strengthen the overall health regulation framework in Singapore. And in this context, when we look at the consolidation of these areas of health regulation, AI and digital health is a key area which is both benefited and supported by looking at regulation in this way as a continuum rather than in silos. And of course, it applies to other areas that you see listed on the right, but our specific interest today is on the regulation of AI and digital health. At a global level, there have been various diverse approaches to the governance and regulation of AI. And traditionally, AI has been regulated in healthcare through software as a medical device, or SaMD regulations. But overall, regulation is still generally nascent and developing, and there are diverse priorities and focus areas, as the illustration shows. But because of the importance of AI at a national level, Singapore is establishing a National AI Council chaired by the Prime Minister to steer the nation's AI strategy and accelerate AI adoption in key sectors of the economy, including healthcare. So to support the development and harness the potential of AI, various strategic and governance frameworks have been introduced. In 2023, Smart Nation SG, a program under the Ministry of Digital Development and Information, introduced a renewed National AI Strategy 2.0 to propel Singapore as a leader in AI, and also to ensure that AI is used for the public good and empower people and businesses to thrive in an AI-enabled future. In 2024, the Infocom Media Development Authority shared a model AI governance framework for generative AI that was also made available through the World Economic Forum to other economies to consider and to contribute to the conversation in terms of governance framework for Gen AI. And more recently, at the beginning of this year, the IMDA has released a model AI governance framework for agentic AI, which of course is a fast developing area. And the framework aims to govern autonomous decision-making AI systems, provide human oversight and accountability, and also ensure safety, alignment, and control of AI agents. Coming back to the healthcare sector, our Minister for Health has clearly enunciated the philosophy, which is that the Ministry of Health in Singapore encourages the use of AI while ensuring safe adoption with safety, clinical efficacy, and cost effectiveness as the cornerstone. And the aim is for healthcare to be AI-enabled or enhanced, but not AI-decided, which means that human in the loop is still very significant. In terms of the governance and guidelines, the ministry has had a set of guidelines called AGILE, which stands for Artificial Intelligence in Healthcare Guidelines. And this has just been updated to version 2 in March of this year. And the Center of Regulatory Excellence supported the ministry in the update of these guidelines, which aim to reflect new AI developments such as generative AI and provide good practice recommendations across the AI lifecycle, as well as support safe implementation of AI in healthcare settings. The Health Sciences Authority continues to regulate AI medical devices through a risk-based approach under the medical device frameworks to oversee registration, lifecycle monitoring, and post-market surveillance. And of significance is the fact that HSA was just recognized by WHO in March 2026 as the highest maturity level 4 for medical device regulation, and is the first national regulatory authority in the world to be so recognized, which helps to position Singapore as a global regulatory reference authority. In this context, the Center of Regulatory Excellence continues to support both the Ministry of Health and the Health Sciences Authority in terms of regulatory horizon scanning and policy review. So to this end, in terms of healthcare AI governance, CORE organized 3 roundtables on the governance framework for AI in healthcare services, 2 in 2024 and 1 in August 2025. And the objectives you can see on the screen were to assess whether a separate governance framework was needed for AI in healthcare, and to look at evolving approaches for regulation globally and in Singapore, and also to look at use cases as well as areas that could be further researched. And we assembled experts from different domains that you can see on the screen to look into these issues. The first roundtable looked at whether, in fact, a distinct healthcare AI governance framework was needed, and in fact concluded that this was not necessary. And I will say more about this in the next slide. The second roundtable looked at use cases for identification of potential risks, as well as the potential regulatory approaches and stakeholder accountability. And the third roundtable was very practically oriented in terms of defining a best practices toolkit that would help developers as well as implementers of AI in healthcare organizations. So the roundtables concluded that while new legislation was not required, the current regulatory tools did need to be reinforced and enhanced with additional guidelines and their scope tested. The regulatory toolkit spans low to high risk and covers the whole range of things from stakeholder education and self-regulation to guidelines, sandboxes, and actual regulations and legislation. So for stakeholder education, the proposal was greater education of lay persons and healthcare professionals. For guidelines that then led to version 2 of Agile being implemented, the areas proposed for a study are listed on the screen here in terms of labeling and accountability of data, trustworthiness of algorithms, and so on. It was also felt that regulatory sandboxes are important to help test the scope of existing regulations for emerging healthcare AI needs in areas such as real-world data, multiple data platforms, and Gen AI. And while the existing HSA regulations were deemed to be sufficient at the moment, HSA has nonetheless introduced a pre-market consultation scheme to provide earlier regulatory guidance and clarification and to facilitate smoother and more efficient regulatory submissions. So the Center of Regulatory Excellence has been working very much to help strengthen healthcare AI regulatory capacity. And this would cover the range of looking firstly at regional AI governance and giving advice on this in terms of policy and regulatory roadmap design and development to align with international frameworks. We also provide various programs to build capacity for regulators, which is extremely important in a fast developing area like healthcare AI. And similar to the roundtables, we are very focused on convening multi-stakeholders in a neutral environment for discussion. The development and implementation of toolkits is also important so that there are useful reference points and templates for developers and implementers of AI in healthcare. And of course, there is necessity for evidence to policy translation to translate technical AI developments into regulatory pathways. So in summary, as we look at the Singapore experience of healthcare AI, it has moved from a position where the foundations have been established through regulation of software as a medical device, governing AI under the Healthcare Services Act, to the development of governance at a national level in terms of AI strategy and Gen AI and agentic AI frameworks, but to prepare the way then to look ahead for the next frontier of adaptive learning systems, real-world monitoring, and also cross-domain regulatory convergence. At the end of the day, we believe that regulation must be adaptive and evidence-led. It has to be responsive to real-world impact and not reactive to every innovation cycle. And we are moving from regulation of AI tools to governing AI-enabled healthcare systems. So I hope this sharing is of use in giving you a perspective on Singapore's experience in healthcare AI. And I would like to thank my colleagues for their kind assistance in preparing this presentation, and also to wish you a very fruitful discussion. Thank you very much. Thank you for inviting me to share on healthcare AI regulation.
Thank Professor John Lim for
sharing
the case of Singapore, which is the country in the AI regulation they're very leading. But not just Singapore. The next speaker will be Professor Jasper Trump from National University of Singapore, and he'll be sharing more on the low and mid-income country context. Over to you, Jasper.
Thank you very much, and thank you to ADB and WHO for allowing me to present some of our research here today. And I'm presenting a study actually led by Dr. Si-Ying Tang at our institution on designing and governing digital health regulatory sandboxes. So what are regulatory sandboxes? And this was already covered by Professor John Lim, who mentioned the use of regulatory sandboxes, but fundamentally, it's a controlled live environment that allows firms and organizations to test innovative products, services, and business models with either real customers or with real-world data, while under the supervision of regulators. It's a combination of an experiment where firms can test novel products like AI in a healthcare setting that's protected, where the interest of consumers and the public remains safeguarded throughout. And fundamentally, it can be used to inform subsequent regulations. So we did a study at the National University of Singapore to assess what are some of the key design principles for organizing a regulatory sandbox. And our study consisted of two separate phases. So in the first phase, we performed a systematic review of published articles and policy documents. And in this sense, we were relatively sector agnostic. So not just in health, but also in, for example, fintech, energy, transport, where you have a lot more examples of regulatory sandboxes. Based on that review, we identified key design principles of how to implement a regulatory sandbox. Then we used case studies in the second phase to then see how these design principles map onto existing regulatory sandboxes. Now, in total, we found 27 articles and policy documents that we've used to identify the design principles and also governance parameters, where we use what we call inductive coding. So we identify different subgroups of principles that are shown here on the right. Fundamentally, there were two major subcategories. One was on the design principles and the other was on governance parameters. We then looked at the case studies, and we took 3 case studies. So the first one was from Singapore, LEAP, the Licensing, Experimentation and Adaptation Program, which was performed between 2018 and 2021, which had a focus on telemedicine and mobile medicine, which was a relatively narrow scope, but fundamentally was also used to inform the new Healthcare Services Act in 2023 that regulates telehealth in the Singapore landscape. We also identified 2 case studies in health from the UK. One is the Care Quality Commission Sandbox, performed between 2019 and 2020, which had a more broad focus on digital triage tools, AI diagnostics, and personal assistance, which fundamentally led not necessarily to a regulatory shift, but to new inspection frameworks and soft regulatory guidance following this sandbox. And finally, we've also included a case study on the Information Commissioner's Office Sandbox, which is currently still ongoing, and which has a focus on personal data use across industries, but also in this case covers health. Now, these were the design principles that we identified. So when performing a regulatory sandbox, these design principles can help inform the actual design, so the practical implementation and design of a sandbox within the ministry. First is that there is a need, which is maybe a bit obvious, of a really clear scope and focus. Like, what is the sandbox going to test? If you take the LEAP sandbox in Singapore, it had a relatively narrow focus on telehealth. The narrow scope and regulatory sandboxes with the narrow scope we found tend to be more useful if the aim is to produce regulations at the end. Whereas if you have a broad sandbox, it will be not as clear in terms of the specificity of the regulations that it can inform in the end. On top of that, you need a defined testing duration. So in Singapore, we had, I think it was roughly 3 years. There's a defined sort of start and stop of the regulatory sandbox. And this depends on the technology complexity, it's the regulatory maturity locally, but also on the participant risk profiles. If there's a high risk, you might want to have a longer sandbox. There need to be clear entry and exit criteria. Entry criteria cover things like novelty and risk management capability, so like who is allowed to participate in the sandbox, but also when do they need to leave, for example, when there's a regulatory breach or other safety concerns. Then you need to think about the incentives. So we did not find evidence of any regulatory sandbox that clearly had financial incentives. Usually, private sector we found was incentivized by being able to be close to the regulator and being part of the process that actually shapes the regulations that come from some of these sandboxes. And of course, you need involvement of diverse actors. So you want multi-stakeholder involvement, both clinical, technical, legal, policy, consumer. In health, I guess I would argue also patient involvement would be critical. Now, when we look at the governance parameters, we identified, based on that literature review, a number of parameters that need to be predetermined. One is the level of derogation. So the degree of regulatory flexibility granted. So what can companies or organizations participating in this regulatory sandbox actually do, and under what rules are they able to operate. Collaboration, so you need to define how will the regulator, or MOH, work together with these firms. What were the reporting parameters? How often do you need to report back on potential issues that might arise during the sandbox? Furthermore, there's a need to decide how liability is handled. So regulatory sandboxes are not without risk. You try to mitigate the risk, but there's also both a practical and financial risk, and who is then responsible during the process of the regulatory sandbox. You need to have the overseeing authority, so that's essentially a supervising body for the day-to-day regulatory team that operates, and we found 4 principles that are key on transparency, legal certainty, public accountability, and equality. So again, these would be the principles driving that team's operations. And then finally, the regulatory impact. So in Singapore, I think it was very well defined. It was designed to inform later health regulations on telehealth, but it's something that needs to be set up front. It is really closely connected to the scope and focus of a regulatory sandbox. Now, when we go back to these 3 case studies, you see that regardless of the regulatory sandbox, the scope of it, the scope varied considerably. So the narrow scope, LEAP had a relatively narrow scope, clear focus on telehealth, whereas, for example, ICO is cross-sectoral, so it includes health, but it's also other sectors. It has a very wide scope and an ongoing duration. So it means it's still ongoing to this day, and it essentially informs data regulation compliance. The entry criteria for LEAP, for example, were by invitation only. So this was determined by MOH. Similarly, for CQC, invitation or only companies and organizations invited specifically by CQC could participate, whereas ICO has an open application. That means that the companies themselves can actually go to ICO to participate. One common factor that we found was that the level of derogation, so the legal leeway that companies get, was very limited. So that means, because we work in health, that patient safety is paramount. And I think that's also what you see when you look at these case studies. Collaboration is generally high across models, so it's an important factor to consider in the design, where there was clear collaboration, for example, in LEAP between MOH and the telehealth providers, and clear feedback on the potential risks associated with telehealth that then could inform subsequent regulations. Depending on the scope, the regulatory impact differs, as I mentioned. So in LEAP, there was a high regulatory impact because it had a very narrow scope. In ICO, there's a relatively low regulatory impact, but that's also not, that's also a product of its broad scope. Oh, my final slide is missing. I guess my final slide is missing. In summary, this is my summary slide. In summary, like we've seen, okay, so we identified 2 sets of design principles, I guess arguably design principles and governance parameters that you can use to implement and design a regulatory sandbox. There is a significant variability in how they are applied. We saw that in some of the limited case studies actually that we could find in health. But they are able to inform downstream regulation. I think that's the main takeaway that we wanted to share with you today. So thank you very much.
Yes, thank you very much, Jasper, for introducing the sandbox for the regulatory. And maybe sometimes the message is stronger without the slide. So next we will be introducing Ms. Kristen, and she will be sharing about the data governance and the intersection with AI governance. So over to you, Kristen.
Thank you. And thank you to ADB and WHO for inviting me to be here and speak to all of you. As I just said, I want to kind of talk a little bit more, and we've heard it a little bit through some of the previous sessions, really speaking to health data governance and the critical importance of this as we're talking then about advances in AI and AI governance as well. So I work with Transform Health. So we're a global coalition of 215 organizations, and we bring together partners and networks to really focus on shaping policy agendas, developing tools, and providing technical support to support and strengthen the enabling environment for the digital health transformation to really ensure that it's equitable, inclusive, and sustainable to help deliver progress towards universal health coverage. Within our work, and we have various objectives, but I really want to focus, one of our core objectives is around strengthening health data governance frameworks and working at national, regional, and global levels. And the focus, and particularly focusing on the legislative and regulatory frameworks around health data governance. Kind of the foundation and kind of the premise for our work in health data governance is really recognizing the critical role and backbone that data plays in supporting and strengthening health systems, and particularly in the digital age, with increased generation of data, the need for that data to be governed effectively and equitably, because it presents a really important opportunity, but a lot of risks as well in the absence of that robust data governance. So one of the downsides of coming a bit later into a program during a meeting is that a lot of the arguments I wanted to make have actually been made. But also I would actually flip that and say that's probably a positive coming late into a program, because a lot of people that have spoken before me have already helped to make the argument that I wanted to make as a foundation for this presentation, and particularly during this morning's session, which spoke a lot to this. So I just want to maybe highlight 4 key points as a foundation, then I'll go on to share some of the kind of tools and frameworks that are being developed and work happening in this space. So the first one, AI is changing the game, as we know. It's generating data at unprecedented scales, but it's both consuming and generating that data. So really a fundamental part of AI. However, AI in healthcare is only as good as the data that it uses. But while AI is advancing a lot, and we've heard some really fantastic use cases around this, unfortunately, the governance frameworks around that are not advancing at the same speed. They're still really catching up, which creates a lot of risks, as we've talked about and heard earlier. We also see that there's a governance gap when it comes to health data. So while a lot of countries and regions are making really fantastic progress, many in this room, we heard some really exciting examples earlier from regional progress, their approaches vary, and different countries are at varying levels of maturity when it comes to their health data governance. And generally, there often seems to be still a lack of kind of robust and comprehensive health data governance, legislative and regulatory frameworks. So at Transform Health, we've carried out around 27 now legislative landscape reviews, looking at the national legislative and regulatory landscape to look at kind of where some of those strengths and gaps are, to identify where some of the challenges countries are facing. We've also brought together a number of governments during various convenings, including around regional convenings, the World Health Assembly, to kind of share those national experiences and where they see, where some of the challenges they're facing, to see where some of those kind of commonalities are that countries are facing. So just want to highlight a few of those that we've seen. So while a lot of countries have broader data protection and privacy legislation, a lot of them aren't health-specific laws, and I'll get to that in a second, why that's really important. Some countries rely on outdated frameworks, and as we've been hearing over the last 2 days, given the advances of AI, those frameworks or legislation that were developed maybe 10 years ago might not be equipped and adapt for the digital age, and particularly in the age of AI now. While some countries might have kind of policies and strategies around health data governance, they don't have the legally binding instruments, so those haven't been translated into law. A lot grapple with kind of the balancing of between protection and responsible data use, and we know data is only as valuable as when it's used to improve health benefit and health outcomes. And then where we've seen some particular kind of weaknesses in legal provisions around, for example, consent and consent mechanisms, particularly, and we heard this a bit yesterday, around secondary data use. A lot of kind of weaknesses around cross-border data sharing legislation and what's needed for that, around kind of data rights, community data rights, gaps in AI-specific data regulation laws, and some limited capacity to really implement the laws where they exist. And then also challenges around kind of cross-ministerial interaction, kind of who holds that responsibility for those laws. Is it the ministries of health? Is it the ministries of ICT, et cetera? But we also recognize that the risk of inaction is too great. So we can't just keep talking about it. We need to be doing something about it as well to really address that. Without addressing it, we risk things around privacy violations, rights not being upheld, the biases in decision-making, discrimination, cybersecurity breaches, lack of transparency and accountability, and eroding people's trust in those health and health data systems, and now also with AI. And trust is fundamental. If people don't feel that their data can be trusted as they're using AI systems, they may be less willing to allow those systems to use their data. And if we're not using that data, then the value and kind of the potential that AI and digital systems hold will be undermined. There was a great stat yesterday, can't recall exactly who said it, apologies, but that 27% of people aren't happy. Oh, so only 27% of people are happy with AI having their data. And I think that speaks volumes, and the need for, if those legislative frameworks are in place, they might feel a bit more trusting of how their data is being used by those systems. So we really believe then, as we're talking about AI and AI regulation and governance frameworks, that data governance needs to be central to that discussion. If we want to regulate AI effectively, we need to start with how the data is being regulated. So they're not separate discussions. They are very much the same discussion. We're looking at the same issues. And therefore, as we look at the solutions, we're often looking at the same solutions, how we can really bring these together. We're having a great talk earlier. Ooh, coming out of time, kind of looking at two sides of the same coin. So let me then just really go really quickly through a few slides of one, just to say that, so really ensuring that we need to make sure we have rights-based, equitable, people-centered health data governance, and really designing the rules to make sure this happens. Central to that is having kind of really guiding principles to lay the foundations for that, equity and rights-based principles, to have then the legislative frameworks around it, but then also to make sure these processes are inclusive and meaningfully engage kind of communities and citizens and the public as well around these discussions. So just quickly, some of the tools that can support, as different countries are at different phases, but here are some of the tools that can support some of that work and also support discussions around kind of regional and global frameworks as well. So Transform Health, together with a number of our partners, some in the room with Ahin, we develop a set of equity and rights-based health data governance principles, which provide that kind of equity and rights-based foundation for health data governance. Those were developed through a very inclusive process, have been endorsed by 170 organizations and governments, a couple of the governments here today. And we really encourage others as well to not only use these, but also, show your commitment around equity and rights-based health data governance. Through the QR code there, you can endorse the principles, and we very much welcome those endorsements to show that strong commitment. We have also realizing that principles are really important to lay the foundation. They also aren't legally binding, so we need to turn those into laws, needing those strong legislative frameworks that provide the binding instruments, the legally binding instruments, to ensure the accountability of all actors collecting and using data within the country, and also to provide those avenues for redress if populations feel that their rights are being infringed upon or those rights aren't being upheld. And really argue that, because a lot of countries do have their data protection laws, but that we need health-specific laws. Health data, very particular category of data, it's some of our most sensitive data, so requires really specific legislative provisions that protect that particular category of data. So really important to have that as well. So another area of work, Transform Health, again, with a number of our partners and through a very exhaustive, inclusive process, have developed a legislative blueprint, which can be used as a tool, again, by countries as well as regional and global discussions on this, It provides legal provisions. It's not binding, but very much a tool that can be used wholly in part to support then national, regional, and global efforts to strengthen legislative frameworks. And then, yeah, just one other area, we've also been working with a number of countries to support a lot of these efforts, including regionally across. In Africa, we've been working closely with our partner Helena to help support some of these efforts in countries in Africa, and working with AHIN as well to support some of these efforts in Asia, to support governments in strengthening those national frameworks. So supporting with that, providing that legislative review, identifying where their gaps and needs are, bringing together stakeholders to validate and build consensus around that, and to develop a roadmap that can practically be taken forward to strengthen the legislative framework. Final thing I'll say before a final set of recommendations, call to action, is just that, well, it's very much governments in the lead about strengthening national frameworks. There is an important role that we think regional and global cooperation can play. We heard about it this morning with the example from Latin America. We heard the call also after that around, Asia needs to be doing the same thing. And then there's also really important opportunities, for example, with the World Health Assembly, to promote that kind of cross-country learning, to establish a set of legislative standards, to promote that kind of compatibility and robustness across countries, but also to establish those cross-border data sharing protocols as well, and provide a blueprint that then can be used by countries as well. Just one final plug, the World Health Assembly has this on the agenda this year. So it's a really important opportunity to make sure that we use this opportunity of countries coming together to really make a commitment, ensure that these discussions lead to very kind of concrete next steps, for example, towards a global framework that can really establish kind of that global standard on health data governance, which can support all countries essentially. So I'll leave with that final recommendation, and thank you, and I'm apologies for being a bit over time.
Thank you very much, Christine, for the very comprehensive presentation on data governance. When you talk about AI digital health with our member countries, maybe this is the first question they always ask about the data privacy and data governance. So from ADB side, not only WHB Pro, we are keen to work with Transform Health, and let's work on this together. I think it was a very good segue. So the next speaker will be John McLeod from Health AI, and he will be sharing his perspectives on the regulatory network, on how we can work together on it. So over to you, John.
Well, good afternoon. Where I grew up, in a village in Mindanao, it's a far-flung area, we had this tradition where if there are events, family events, we would ask neighbors to lend us pots, extra chairs, plates. I think my kababayan, my Filipinos here from the province can relate to that. And then at the end of the day, we have everything. And what I've been thinking is that this is the same with artificial intelligence and health today in the region. No country has everything. Not even the most powerful or the most advanced countries. I learned that today that, was it Korea or China saying, oh, we are advanced, but we don't have everything, right? Not the full data, not the expertise, not the regulatory experience. But together, collectively, we do. And that's what I'm going to talk about in my, 4 minutes of presentation. Just a reality check. Okay, this is not mine. Most health AI systems today are trained using data from high-income countries, and that has real consequences, right? It reduced accuracy for underserved populations, potential misdiagnosis, and widening health inequalities. And the way forward, as what our colleague has been already doing, our colleague from Transform Health, build diverse and representative global health datasets. invest in local digital and data infrastructure. I think there was highlighted several times yesterday about infrastructure. And then establish fair and inclusive AI governance framework. So at Health AI, we convene governmental authorities under our global regulatory network. As our commitment to the countries, we help them develop and strengthen national and regional validation mechanisms on responsible AI for health through our strengthening or capability strengthening initiatives. Also, we are creating a global public directory of validated AI solutions for health. So this is a platform where members of the regulatory network could share the validated AI solutions in their country so other countries could see and check, oh, okay, this has been approved in Singapore, and so this has been approved in Malaysia, so maybe we can consider it in the Philippines. And also, we are establishing a global early warning system. So it's another platform where the members of the country or members of the regulatory network could share, let's say if there are adverse events, they would put it in the platform, and then the other members of the network will be notified. So as of today, we are happy to say that we have our 10 pioneer countries, one country to be announced officially soon. So these 10 countries cover 20% of the world population. So looking at a wider picture, like what we are doing in our regulatory network would impact the lives of 28% of the world population. So 5 of these countries are in Asia, and last week, as a Filipino, I'm proud to say that the Philippines, through the Department of Health, signed an agreement to be the latest member of the regulatory network. And then 8 of these countries are from LMIC, and 2 from high-income countries, which are the United Kingdom and Singapore. And aside from that, we have also the community of practice, and this is for the non-governmental institutions. So, before I close this, I would like to ask everyone to look around you. Well, not just quickly, please. Just look around the room. Yeah. Several countries, perspectives, and expertise are represented in this room. Now imagine if only few, maybe from this side, will decide about AI in health. Well, spoiler alert, not everyone will benefit from it. That's why the way forward is through collaboration, regional alliances, and thank you very much.
Thank you very much, John, for the very inspiring presentation. Indeed, we all have to work together on it, especially on the equity side of AI. So let's try Pei Ling once more. So Pei Ling, are you online? And did you fix your internet?
Hi, Jay. Can you hear me now?
Oh, yes, very clear. Please,
Perfect.
Over to you, Pei Ling.
Thank you so much. Yes. Thank you all. And again, apologies for my low bandwidth just now. It's my pleasure here today to speak with you. Unfortunately, I cannot join you in the Philippines. But what I'm going to share with you is really a report that we released last December, looking at the AI in health global governance landscape. Next slide, please. Next slide, please. Yeah, thank you. So I know that Jay said that I was supposed to set the scene, but we basically did a deep dive with all of the previous presentations. So maybe let me sort of zoom you out a bit now to just look at what has been happening in the world when it comes to AI governance in health. Within this report, basically, we shared a timeline overview of international convenings and policy instruments launched in the past year. We also did an analysis of the global regulatory trends. We deep dive into the AI governance and health ecosystem for 8 selected jurisdictions. And finally, we also synthesize findings into actionable recommendations. Next slide. And then we can move on to the next slide. So I'm going to highlight to you 3 global trends that we are seeing. The first one is really, we noticed that the regulation of software as a medical device is really laying the foundation for AI and health regulation. So the regulation of software as a medical device by default includes AI as a medical device. So this reflects a shared recognition that AI-enabled SAMD must be safe and effective before reaching patients and citizens. Alignment with IMDRF-based risk classification frameworks is actually there. So that's good to know that the countries are actually generally referencing to IMDRF guidelines, but there is still contention with the different specifications and definitions of AI and SAMD. Particularly, we're seeing a regulatory gray zone, and that's where when in-house AI AMD used in hospitals and direct-to-consumer AI applications are being applied, they generally, at this point, do not fall under the medical device classification, and therefore, regulators are coming up with mechanisms to address the gaps. For example, the use of model cards for AI AMD to increase transparency, predetermined change control plans to allow for certain algorithmic modifications post-approval, and also innovations is needed very much for post-market surveillance, given that our AI systems are continuously changing, and therefore really trying to make sure that the regulators have expanded authority for the total product lifecycle monitoring. There should also be mandatory reporting of real-world change performance, effective incidents response mechanisms, including retrack systems. If we go to the next slide, we will see that the second trend that is going on is that when we look at AI and health, we can no longer just look at health regulations. We need to look at general AI legislation as well. So these countries are really forming a multi-layered governance architecture, combining horizontal national AI strategies, data protection legislation, as we have heard from Kirsten, digital health infrastructure, and sector-specific medical device regulations. So I'm going to use the EU AI Act as an example. Here, obviously, EU AI Act actually interplay quite a bit with the medical device regulation. And there we really need more clarity on whether the same notified body can conduct conformity assessment for both legislation, whether the same or separate regulatory authority will be needed for both mandates. And definitely a lot of guidance to support enforcement. The next example I'm going to look at is in Peru. We actually have a Peru AI law, which actually demonstrates the country's commitment to responsible AI, but there is still a need to increase enforcement capacity to really operationalize the law. And the last example I want to give is from South Korea. Here, South Korea actually released the AI Basic Act last year, where AI products entering South Korea must get MFDS approval under the Digital Medical Products Act, but also ensure that there is compliance with the governance standards of the AI Basic Act. Next, for implementation to really take place and for this kind of harmonization to take place, there really needs to be strong institutional coordination within the country, training the regulators, accrediting assessors, and establishing compliance roadmap for the industry. Now, the third trend, the next slide, where we will see is that there's really this emergence of digital sovereignty in health. Digital sovereignty is becoming a critical factor in country strategies. And therefore, a lot of the countries are actually adopting very tailored digital health platforms for health data. As what Kirsten has said, data governance is, of course, very central to regulating AI and health. And at Health AI, we strongly promote that as well. I'm just going to go through quickly what we are seeing across different jurisdictions. So with EU, we definitely see that EU, of course, there's a GDPR where everybody is very familiar with. But also more recently with the EU European health data space, they're coming out with more regulations that can increase human rights and controls and promote data interoperability. In Brazil, there is a GDP law that mimics the EU GDPR, but there is a lack of a creation of national health data spaces and the clarification of lawful basis for secondary users. And if that can be tackled, we believe that that will be able to provide a more integrated data governance architecture. And finally, what we're seeing in US with the HIPAA law is that it is quite relaxed compared to their counterparts, and therefore perhaps stricter requirements and expanded scope of the act may need to be passed. What we're seeing, some of the challenges when it comes to health data governance is that Health adjacent data from wearables and consumer applications often fall outside the scope of traditional health data privacy laws. And the next point would be the re-identification of patients, because we talk about data privacy. Sorry, if you can click next. We talk about data privacy, right? So re-identification is becoming increasingly possible through cross-identification from different data sets that may enable someone to infer individual characteristics. The next slide, I'm going to talk now a bit more on the quality country analysis that we did for selected jurisdictions. Here, we actually looked at 8 countries, and that is Brazil, China, India, UK, Singapore, US, Vietnam, and Zambia. And here I'm highlighting some cross-cutting challenges that we're seeing across all of these countries. First is the regulatory fragmentation. What we're seeing is really within each country, you get multiple agencies with overlapping mandates and limited coordination mechanisms. The second challenge is that with adaptive AI becoming more and more mainstream, the current regulatory frameworks or governance frameworks are actually very insufficient for these continuously learning systems, particularly post-deployment. Now, perhaps except for Singapore, we are also seeing across all the other 7 countries this infrastructure inequity, right? There's really uneven connectivity and digital literacy between the urban and the rural regions. And finally, the last challenge that we saw was that there is still a distance between ambitious strategic visions that governments have in their strategies and policy versus enforceable regulations. So putting all of that into practice, mainly due to inadequate institutional capacity. So in my next slides, I'm going to highlight 2 countries out of these 8 to show you how it is like for some of these countries, right? And again, if you refer to my first challenge, which I talked about just now, with multiple agents and multiple agencies with overlapping mandates, and this is really a scenario also we are seeing in China. When you look at all the players, let's say, when it comes to China's regulatory ecosystem for AI and health, you see that the top 4 that are listed in the bullets here, for example, with the State Council, they are really providing very top-level legal and policy oversight. You have a data administration that looks at data integration. You have a Ministry of Science and Technology that is driving research and innovation policies. But yet, at the same time, you have the Cybersecurity Administration to focus on data security. Now, when you look at the last 3 bullets, where the 3 organizations listed, that's where the health organizations come in. So you have your NMPA, which is your FDA equivalent. They handle approvals and safety evaluations of AI AMD. And then you have your National Health Commission, which actually look at clinical applications of AI in healthcare and issues guidelines. And then finally, you have your National Health Security Administration that focuses on pricing, standardization, medical insurance, and value-based access to AI-enabled health services. And now if you go to the next slide, it's very interesting with China, the way they adopt their governance strategy actually has a 2-phase approach. The first one is really first to build up the robust digital highway, right? So here, what they try and build is to set up the right governance standards as well as the data platform. So just to say that AI and health is a very state-led digital transformation agenda within China. If you look at the State Council, they have actually issued a lot of new policy late last year to promote application of AI across all healthcare services, including their Internet Plus Healthcare. Right now, there's more than 3,340 Internet hospitals in China, with the National Health Commission issuing a regulatory document on what are the regulations for internet diagnosis and treatment. And the next stop, again, I think people are going to talk more about AI hospitals, agentic hospitals. On the other side, you have the AI plus healthcare, which really looks at how to promote and regulate. So it's actually interesting to see how even within China, who is a strong innovation powerhouse, they want innovation and regulation to go hand in hand, and therefore they are very focused on using AI properly and safely, with a focus first on primary care by 2027, and then on secondary and tertiary care by 2030. And then, of course, on the right side now, you will see that there is this big medical data platform that they're trying to build. Again, going back to that digital sovereignty point, right? They are trying to construct a 4-level population health, so country, municipal, provincial, county population information health platform. Well, the next slide now, once you have built this robust digital highway, what happens is you can start to bring in the vehicles, and here I'm talking about AI applications, to really drive safely and effectively on the highway. And here, this is where NMPA, their FDA, actually plays a very strong role in leading these vehicles onto the roads. With NMPA, their regulation of AI and health is actually firmly rooted in the SAMD framework. So they have developed specialized guidelines for AI AMD, particularly for class 2 and 3, looking at risk classification, technical review, transparency, validation of performance matrix, but also post-market surveillance. So mandatory reporting of adverse events, periodic re-evaluations. They are also providing priority support and increased registration guidelines for very high-risk AI products, for example, implantable brain-computer interface medical devices. But what is heartening to see is that there is more and more alignment, let's say, with international norms, such as EU MDR, IVDR, and FDA GMLP, also aligning their domestic review requirements with ICH rules and IMDRF guidelines to really promote synchronous global innovation launches in China. Now, next, what we are seeing now actually is that there has been actually already over 110 class 3 AI AMD approved by October 2025. And this is really a very impressive number. And with domestic firms holding over 90% of its approval. Next, what is also important that despite all of this innovation, what we're seeing is that governance is actually emphasized. If you can click next. Just last year, the government actually launched this global AI governance initiative that really emphasized ethical principles of people-centeredness, safe and controllable, and fair and inclusive. So now that I've gone through China, let me just quickly go through Vietnam. Vietnam, of course, is in a more nascent stage when it comes to their AI governance strategy for AI and health. But nonetheless, they do have, the right foundations in place. For example, they have legal instruments for AI governance. They have the digital technology industry law. They have the decree on personal data protection. And then more and more, they are coming out with their own digital transformation agenda, right? So prioritizing electronic medical records, telemedicines. And when it comes to AI applications in health, they are currently regulated under the software as a medical device pathways. What we have seen by working with Vietnam is also that this capacity, the law is in place, but the regulatory actual practice got to be reinforced. And this is why we're happy to really be working with Vietnam to empower their regulators to be able to handle this wave of AI that's coming their way. And finally, in order to have more dedicated AI AMD guidance, we are also convening multi-stakeholder in Vietnam to really promote that participation. Now, my last slide now is I'm just going to share a bit of a flavor on what kind of recommendations actually we give to national governments and health ministries. We also have recommendations for other sectors like regulators, AI developers, private citizens themselves. But I'm just going to go through this slide so that then I'm done. So for national governments and health ministries, actually what we suggest is for them to really strengthen formal interagency coordination mechanisms, such as a dedicated AI council or cross-ministerial working groups, and invest in capacity strengthening. I cannot emphasize that more enough. Adopt policy-making designs that include participatory processes and evidence-based approaches. This is more and more we're hearing from a push from citizens as well to be heard and to be included in the policy-making processes. And AI really gave a great opportunity for the governments to do that. And finally, of course, they have to prioritize in foundational infrastructure, particularly electricity, broadband connectivity, digital health platforms, and of course, AI literacy social-wide. So I think I'm going to skip the next 2 slides. You can just skip it. And then I'm quite sure we will have a chance to talk about it in the future. But for now, can I encourage you to scan the QR code and download our report, so then actually you can read the recommendations for yourself as well. And with that, I come to a close. And again, thank you for having me.
Thank you, Billy. My job today is fairly straightforward and simple. Can I invite all of the in-person participants here, Kirsten and Jasper, as well as Jay, my co-facilitator? Yeah, lady first, please. Yeah. Pei-Ling, are you still with us? Just to check whether the internet works.
Yes, I believe so, right?
All right, sounds good. I think that we don't have much time left. I think it's approximately 25 minutes. So, but we do have a very great, I would say it's great and very intellectually stimulating session, even though the topic, as Jay mentioned, is relatively boring. But I personally don't, I disagree. But anyway, I will pass it on to Jay for the first question.
Oh, yes, thank you very much, Mengji. And my first question will be to Pei-Ling. So I really liked your metaphor on having the highway in the countries, but you know, there's not much countries that has that highway. So with the bumpy roads without the regulatory framework in place, what would be the minimum regulatory posture that the countries can adopt? Would regulatory reliance only be the way, or would there be any other practical things that the countries can do?
Thanks a lot, Jay. And I'm glad that you like my analogy. So actually, when I think of the purpose of regulation, when we ask ourselves, why are we regulating, right? To me, it's a very strong, it's a straightforward answer. It's to do no harm. This is to do no harm to our patients, to do no harm to our citizens. And therefore, I think the most important thing I think one has to think about is even without full regulatory frameworks, we need to prioritize safety. And how do we do that? I think countries can make sure first that they have a human-in-the-loop mandate, so they can ensure that healthcare professionals have the right training and final autonomy on their clinical decisions. They can also adapt a risk-based approach to governance so that they can focus more on regulating high-risk AI products that can cause substantial harm. The second consideration I want to share for the regulators is to really ask for evidence that the AI system has been actually validated with local data. Because when the system isn't validated with data representative of the local population that it's going to serve, it's not going to work very well and it's not going to be very accurate. The systems that are often trained on international data do not represent local population and realities, and therefore it is extremely important that this actually is put in place. Now, the third consideration is that even if the country cannot fully review the AI tool, what we think they can do is to at least maintain a register of them. Here, they can at least request for the vendors to provide the intended use, known limitations, performance matrix, and compliance with international standards from WHO, ITU, and ISO. And then for countries without full AI regulations, they can also enforce these basic data governance and protection principles and standards, as Kirsten has outlined. Now, the final consideration I would say is to really make sure that there is some form of post-deployment monitoring. So maybe mandating a very simple reporting mechanism for manufacturers and healthcare professionals, so that when they detect adverse events, when AI is deployed in the real world, they can actually report back. Now, to your last question on whether regulatory reliance is sufficient, I think this can be quite an effective way to get more regulatory oversight for low-resource countries. However, I have to emphasize that it cannot be a passive rubber stamping of foreign approvals and should not be a total replacement of local regulation. I think regulatory reliance actually works best when countries have set a minimum regulatory posture, as I've just mentioned above. And most importantly, I think there needs to be local regulatory capacity, whether or not you're leaning more towards regulatory reliance or your own regulatory capacity. There needs to be some form of regulatory capacity, which is why at Health AI, we are focusing on ensuring that our capacity strengthening efforts for policymakers and regulators within our global regulatory network have a strong emphasis on LMICs and not just high-income countries. Thank you.
Yes, thank you very much, Pei Ling, for sharing. I can't agree more. And just hearing the comment from Pei Ling, I hope everyone still remembers the exercise we did on the questionnaires that we had. I think that could be one of the instruments we can use.
Thank you for promoting us. I have a set of questions for Jasper because we're actually very interested in understanding more about Sandbox. I actually have 3 interconnected questions. So first is, when you introduce the 3 case studies, I'm just in general curious, how do hospitals implement the Sandbox? And do they actually have those well-trained lawyers to do this implementation? And the second is, I want to talk about the access, like the time to market, as well as a procurement aspect, because once you're done with Sandbox, the next natural step is for the product to be accessible on the market. So how does that loop get closed? And sorry, because I'm not sure if I would get another chance, because I think there'll be a lot of discussions. How do you foresee such a new mechanism being implemented in LMICs?
Yeah, no, thanks for the questions. I think, okay, so maybe to tackle them one by one. The first one is like, what do you need to implement? I mean, I don't know if I'm the right person to answer that question because I'm not an implementer in this, that would be the ministry, but I can at least give my own thoughts what you need. I think first is that at the ministry level, you would need the expertise to do so. That needs, like at the governance level, you need legal experts, policymakers that either have experience or have some kind of a capacity in organizing a regulatory sandbox. Second is you need financing. I'm very happy that we're sitting here in ADB because that would be one of the things that would be necessary to actually run the experiment. The examples I gave, the case studies, were all financed by, except that the third one is you have to pay. It's a consultative process for the company, but the first 2, the government finances the sandbox, right? So I think it's a combination of those aspects that you would need. I mean, if you look at the technicality of it, I mean, I would argue that it's complex to run, but achievable for a ministry. But I think it's just human capital and resources you need to implement it. What was your second question again? It's not.
Procurement.
Oh yeah, procurement. Yeah. So to me, this is one of the main issues that I really struggle with, and regulation and procurement, because the time to market for AI apps, especially now that Claude and other things can also help you code these things, it's very short. So that means that the development and execution of these apps compared to, let's say, conventional drugs is very quick, and it means that if you're MOH or you're a public healthcare system, then you have maybe hundreds of apps to choose from. And then how can a regulator regulate all of this and review all of these apps that will come up for regulatory approval? I think that's, to me, is maybe a bigger issue. And in the sense that, to me, it also relates to then how do you implement these type of AI algorithms in your health system? So I think, for example, in NICE, because the HCA agency in the UK now has a way, to my understanding at least, to essentially do it tender-based. So that means that actually they define the need case and then go out to the developers to say, this is what we need for a health system, please develop an algorithm for us, right? And that could also tie in with the regulation at that point, because the algorithm at submission would then also go through the regulator rather than the other way around. Anyway, that's just a thought, but it's an issue that I think I struggle with, and I hope that also maybe people in the room will have an answer to. Yeah.
There's one more, because this is so new. I remember in Singapore, UK, and potentially Germany, these probably are the only countries that have run sandboxes so far. So if we are going to introduce sandbox as a way to lower the entry bar of AI access in lower middle income countries.
Yeah, but the question is, I guess, I don't know, regulatory sandboxes are used to identify the risks of implementation. So if you assume that, for example, the risks of implementation are shared between a country like Singapore, or a country like Malaysia or the Philippines, then I wonder to what degree is it worthwhile to rerun a similar sandbox somewhere else. I think what we saw a couple of examples here of model laws and regulations that can be implemented. I think maybe those tools at that point might even be more valuable than the sandbox by itself. The sandbox can inform some of those model regulations, but then I wonder whether, it's just more of a question, I don't know whether it would hold the same value at the cost of it, right? In each setting, I think, in that sense.
So if my understanding correctly, chances the output from the sandbox could be referenced.
That's right. Yeah, that's right. So like it's kind of like the regulation in Singapore for telehealth, right? So like if you have a really new, novel niche algorithm or software, a regulatory sandbox in Singapore could identify the risk, or anywhere else in the Philippines. But that would then arguably, to me at least, be useful also for other countries like in Laos or Cambodia. Because if you assume that the risks are shared, right? I think the main thing that would be different is the legal environment, right? That would be different per country. But that's, I guess, arguably why you'd have these model laws, in my opinion.
Thanks. I do have more questions, but I would like to pass it on to Jay.
You can have a separate discussion. So my next question will be to Kristen. It's in a similar context. I mean, I think it's not enough to emphasize the data governance for AI regulation, but similar to the regulatory framework, in the countries which doesn't have a strong data governance, of course, the answer will be to build a strong data governance system, but the countries with the weak system, they are using AI technologies already. So for those kind of countries, what would be some practical mechanisms that they could adapt for patient safety, data privacy, and those kind of things?
Yeah, thank you. You anticipated a little bit what I want to say, but I will challenge back a little bit that what can we do while we wait? I would actually argue we can't wait. So it needs to be a political priority. I think it was Dr. Torres said this morning, as we're building, I think it was the house or the boat, we need to ensure this is embedded as part of that process. But it really needs to be a political priority then. If we can advance AI and digital tools so much, why can't we put that same effort into advancing the legislative and regulatory frameworks around that? And I think also I think often it's seen as, oh, it's slow, if the political will is there, it can be faster. But it's not about then stifling that innovation. It's also about, by having that secure regulatory and legislative environment in place, that can also foster a more secure environment to help foster and further that innovation as well, but also importantly to make sure that those advances really are delivering what they should be delivering of, protecting people's rights, but also ensuring that those advances are improving equity, improving public health outcomes, public benefits. So I think it's not a nice to have, it's not what can we do later. I think we need to really prioritize that we're starting to do it now. But yes, of course, where do you start from? You need to start from somewhere. So while I mentioned the legislative blueprint that we had developed, one of the core things is that brings a very health-specific lens to it. But I think one core starting point, if a country doesn't have a general data protection law or act, that essentially is the first step. And then, this can help support of making sure there are the adequate health-specific legislation or provisions in place. But I think also yes, legislation takes time to be passed, et cetera. We need to prioritize that. But at least a starting point is things like ensuring that, you have the right principles in place that at least would lay that foundation for those laws that come afterwards. Maybe developing a health data governance framework that, while it might not be legally binding, it at least sets that broader framework of what is needed and then can be implemented into law eventually. So I think those are kind of some of the areas we can start with. There are a lot of, I mentioned already some of the tools and frameworks that are out there. So there is also a lot of learning that can happen from, different tools or frameworks or other country and regional experience as well. So I think it seems like a daunting task, but I think there is a lot of good practice out there that can be built upon, so it's not as daunting, but it really just needs to be a political priority as well.
Oh, yes, thank you very much, Kristen. And I think we have very good delegates here from the countries. I think everyone here in the room can be the champions for that. But yet to say it's an intersectoral, interministerial problem. So as from Ministry of Health, it may be difficult to engage with other ministries. So you can leverage us, like Transform Health, like ADB, like WHO, to have that conversation. So we could work on this together.
I see a hand in the room. Dr. Park.
Thank you. Thank you for the insightful discussion. I believe we all agree that establishing regulatory legislation, prioritizing safety and health equity in health AI is a primary task. However, given the fierce global technological competition and the reality that private companies are driving this innovation, I would like to hear your ideas on how we can effectively persuade, build good incentive systems on political will, and align with these corporate stakeholders. From a market perspective, individual countries with small populations and lower purchasing power share common difficulties in this regard. In the case of Republic of Korea, which only takes 1% of global health expenditure, for example, the Framework Act on AI, basic AI, was recently passed. However, the implementation of the strongest penalties was deferred for a year due to various practical considerations and industry considerations. So, Pei-Ling, Christine, and all the rest of the panels, I would like to hear some comments or thoughts about this.
I can maybe start with the initial one and then Pei-Ling. I'm sure we'll have something to say. I think we need to flip that a little bit, because that it almost seems then it's the private sector is in the driver's seat, when really it's the governments need to be in the driver's seat. You know, we're talking about national health systems, you know, the public health outcomes, health access, public benefit. So I think it's flipping that of it's not how governments can respond then to the private sector interests, but really governments being the driver's seat. And then also really, as I know I keep repeating it, but you know, why then governments need to have those laws in place, because it's binding for all actors within the country engaging in, you know, AI, collecting, using data, et cetera. So it would kind of then hold all of those stakeholders accountable. So I think that's why it needs to be kind of governments really guiding this rather than private sector. And then, you know, we have heard from different private sectors actors as well that by having that legislative framework in place in a country, that also gives the confidence in operating, because there's a more predictability within the environment they'd be operating within a country. So I think it's just, you know, going back to the point that it's the governments really need to be in the driver's seat as well.
Maybe can we go to Pei-Ling?
Yes. Can you hear me?
Yeah.
Yeah. Okay, so thanks a lot for that comment. And I think there is actually a school of thought currently that talks about, you know, that argues for the fact that regulation will hinder innovation. But before we get too deep into that argument, I just want everyone to take a step back and really kind of look at where we are today with innovation and regulation of medicines, so drugs, right? If we look across the globe, right now, the research and development of the most innovative drugs are happening in countries where they have clear and strong regulations, because that ecosystem has actually given investors the confidence and trust that the developed medicinal product will actually be safe and effective. Currently, a lot of the medicines regulatory authorities in LMICs are actually playing catch up with their HIC counterparts, precisely to gain a share of that investment. So I think we do need to be careful here not to repeat history when it comes to AI innovations in health. I think if we want to build innovations, we got to build them safely, we got to build them effectively, right? We don't want to kind of race ahead, break things, but rather, you know, be the hare and, be the tortoise, not the hare. Be the tortoise, kind of taking good, steady steps towards that AI-driven future, the AI-driven safe future that we want, but not to go too fast in a way that we will eventually bring harm to our citizens and patients. Thank you.
Thank you, Pei-Ling. I think, Jasper, do you want to comment on this, or?
No, I think a lot of it has already been said. I guess one of the challenges is that what we see, this is maybe a role that WHO can play, is that clearly strong regulations are important, but then the implementation part, so I work in a hospital, is still really challenging. So for example, I'm a doctor, not a lawyer. So then when I look at these rules, it's almost like a seance. I try to interpret what they say. But usually you'd have to call the legal department to, and we have a very short-staffed legal department, even in Singapore. So I think I would argue that we need to think both sides of the coin. I think the implementation of it is something that needs to be considered when actually coming up with the regulations of it. And it requires a lot of manpower.
Can I make a quick comment on Pei-Ling's comments? So yeah, actually, you're right about the actually strongest regulations and the most fierce innovations. However, I see it, one of the reasons that they have the most fierce innovations in that specific market is their spending, the market size number one. So the reason why we are struggling with this is because we don't have enough market power, like purchasing power, as an individual country. So I want maybe see a glimpse of chances to making more rigorous or robust opportunity to make a new regime or new order about this equitable and more responsible use of AI in the context of health by combining the markets with at least with regard to the regulations and equity considerations. Maybe international bodies, international organizations can have one of the strongest role in that kind of implementation. And I think, that kind of inputs can be really interesting and more informative for future generations to implement this and maybe push a little bit further local politicians. Yeah, that's what I thought.
I actually very much agree with you. If you have seen John's slide, I believe we said that we are actually growing national and regional mechanisms. When we say regional, what we are thinking potentially would be for countries, low resource countries or smaller countries that could potentially think about pooling, not just their markets, but pooling their regulatory capacity, right? So even what Jasper talked about, regulatory sandboxes, is actually really expensive to develop your own sandboxes, but how about a regional regulatory sandbox that could potentially allow for the countries to work together and provide an oversight to the products that are entering their market. So yeah, I very much agree that that kind of pooling and convening is important.
Can I just also add to that? There's an example, I would say, in ASEAN, right? So in ASEAN, we have the regulatory device directive for software as a medical device that I guess is implemented everywhere. So there's examples, and I assume, I don't know too much, but that there are examples of this in the Pacific as well, I think, where, a lot of capacity is often shared. So I fully agree with just said.
Thank you.
We have 35 seconds left. And I would say I will leave the regional partnership discussion to the final session, but I do want to, as a way to close the session, in our AI technical document in preparation for this year's regional committee meeting, we do want to advocate for the potential creation of a regional sandbox, with us being part of it, to generate evidence to inform the regulatory capacity development. But we would also be very looking forward to more stakeholders around the room to tell us, what do you think ADB and the WIPRO can do collectively for the region? So with that, I will close the session and hope you guys enjoy the break until we come back. Thank you.
Okay, thank you very much. May I request the speakers and the panelists to stay in front? May I invite Mr. John Magkila to join them for our group photo for our session 7. We also have virtually Pei-Ling Yap. You're part of the group photo. May I also remind once again our participants, not only here physically, but online, to scan the QR code. Let us know what you feel and what you would like to improve in this session. We'll also be having our 30-minute snack break We will be back at around 3:30 p.m. Once again, our panelists and speakers for our session 7. I'll see you in a bit.
Okay, discussions around kind of like